Good day, everyone. I am Naftali Joel Butor, an assistant professor at the Department of Human and Family Development Studies, College of Human Ecology, UP Los Baños. I also serve as the Project Development Associate for the UPLB Gender Center and as the Education and Training Director of Balikalipay Center for Psychosocial Response. Today, I would like to share with you about fostering psychosocial well-being amid the pandemic and other crisis situations, mainly from my experience and working with the institutions that I just mentioned. In today's session, I'd like to focus on four discussion points. First, I'd like us to revisit the concept of mental health and psychosocial well being. Second, is to reflect how the pandemic and other crisis situations affect mental health and psychosocial well being. Third is to ponder about the intersection between gender and mental health. And finally, is to survey strategies to engender psychosocial well being through a series of techniques such as self care promotion, psychological first aid, and psychosocial processing. We start by reflecting on the definition of mental health and psychosocial well being. We know that mental health is an essential component of health in general, which is defined as the state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. This definition, we can see how the importance of mental and social well being is equivalent or equal to the emphasis on physical health. And when we talk about mental health, there are certain descriptors of individuals who possess a certain level of mental wellness. So, and here are the descriptors also provided by World Health Organization. First, an individual who possesses a certain level of mental health is able to realize his or her own abilities, can cope with the normal stresses of life, as opposed, of course, to non-normative stresses, which we encounter in emergency and crisis situations. They can work productively, and they are able to make a contribution to their communities. So in this these descriptors, we can see the emphasis on social functioning, uh, which means that to a certain extent, if there is a higher level of subjective wellness and the individual is able to perform the expectations by the society in terms of his or her role in the different social institutions, then we can say that somehow this can be a protective factor for them. Now, how is the pandemic challenging well-being, especially among adolescents and adults? And I'd like here to share with you some of the insights that I gained from the people that I worked with during the pandemic or since the pandemic started. So we know that COVID-19 pandemic is a biomedical crisis, and this has especially been observed during the onset of the phenomenon, wherein people were greatly concerned about uh, keeping themselves safe, ensuring that health protocols are followed, meeting quarantine requirements. But eventually, as the pandemic progresses, we also see another layer of concern, which pertains to a psychosocial, even a spiritual crisis, uh, if we can say it that way. We see that individuals and families uh, experience some level of real and imagined fear. There was a certain level of uncertainty, especially because of the lack of information or the lack of assurance as to whether until when this phenomenon will last and whether our individual efforts are sufficient to really help us protect ourselves and the people that we love from the consequences of the pandemic. Then, of course, the change in routine wherein people who are used to performing their public lives, their productive lives in the workplace, in the schools, started to uh, work at home. And the movements that we used to do prior the pandemic are quite constrained in this situation. So collectively, these psychosocial consequences tend to uh, foster uh, other forms of psychosocial consequences, such as feeling of hopelessness, helplessness, and in certain cases, a significant level of distress. Well, of course, on the other side, I also hear people talking about the pandemic as an opportunity for them to gain clearer vision about their lives, especially that they are able to see the basic things that are really important to them, the most essential things that are previously during the pre-pandemic situation were invisible to their eyes, but now they are gaining insight about what really matters to them. But this is an interesting note because potentially this clear vision can be an entry point for intervention among those people who are finding it difficult to navigate in the current situation that we are in. At the core of the psychosocial consequences is our knowledge that in times of emergencies and crisis situations such as the pandemic that we're experiencing, uh, stress is actually a normal psychophysiological reaction that we experience when we lose our sense of equilibrium, both physical or psychological. We know that this is a normal response to an abnormal situation, but that we also know that if we are unable to manage this level of stress, and it can lead to other forms of consequences that later on might entail a more specialized form of intervention. Among the things that we hear from adolescents and young adults as part of their experience to and or response to the situation is that they are experiencing sleep concerns, they are finding it difficult to manage their roles. There is compassion fatigue for those who are helping. They tend to get tired from helping other people. For those who are trying to cope and meet the quarantine regulations and health protocols, they start getting fatigued already by being too cautious. And others who are feeling some form of distress or finding it difficult to seek help, not only because of stigma or the fear of being judged, but also because of inaccessibility of these services. And in certain cases, the pre-pandemic conditions are aggravated and they tend to resurface, such as in the cases of depressive and anxiety symptoms. Now, what do we know about gender and mental health, and why is it important to view well-being from a gender lens? And this is something that we would like to impart because in typical situations we look at mental health as a separate uh, phenomenon or as a separate entity from gender, but we know also that gender being part of who we are would have an intersectionality with mental health, vice versa. So we know, especially in the UPLB Gender Center where I work with the gender responsive mental health, that there is a very unique context among people of different genders. And there is different there is a different level of um acceptability and level of acceptance among people of different gender. There are different expectations, there are different roles and even rules that govern them as imposed by the society. And these often lead to a unique uh, needs and gender issues as well. So there is also a burden of stereotypes or gender stereotypes wherein the expectations that the society cast among women, such as the expectation that they would be caregivers, that they would be willing to take on multiple duties, just be obedient to men in the family, be submissive, bear the emotional burden, and prioritize other people first. And the expectation also among the men to be the more dominant form, to be traditional, to be straight, to be middle class, or to be working and providing for the family and uh, being more uh, how do you call that being more clandestine with their emotions influence also how they deal with the challenges of situations and its impacts on their own well-being. Uh, a certain model that we subscribe is what we refer to as the modified social stress model, which means that the number of risk factors that is or are experienced of by people across different genders would have an impact on the psychosocial experience that they would have, especially if these risk factors are greater than the protective factors that they have. And in analyzing the uh, impact of any crisis situation among people of different genders, this modified social stress model can be very, very helpful in gaining or an idea or gauging realistically where the person is coming from or where the person is at a particular situation. So at this point, I'd like to share with you insights from anecdotes among people who I encountered and who we supported also across the pandemic. People from different genders and what are the risk and resilience factors that we observe. So among women, we see that the stereotype of uh, what a traditional woman should be can be a risk factor for them, especially when it leads them to prioritize others' needs and let go of their need for self-care as well. The multiple burdens among women, the great exposure to COVID-19, especially as we all know that majority of healthcare workers globally are women or females, the emotional labor as caregivers that they have this not only the responsibility to ensure family safety, but they also take in that emotional burden uh, to keep the family safe. And usually when children get sick and the mother is the one taking care of the family, the blame also goes to the mother. And in certain cases, there are uh, anecdotes of violence in the home, domestic violence, that have existed prior to the pandemic, but due to the constrained movement, are becoming uh, more emergent in the community at the community level. On the other side, we also see and hear resilience factors such as family and peer support system, women empowerment, the availability of sexual and reproductive health support, positive coping, and health seeking. For men, and the intersectionality between mental health and the pandemic experience, we also see that stereotypes of masculinity, specifically in the aspect of uh, how they manage or how they should manage their emotion, uh, is a form of risk because there are men who feel that they need help, that they need someone to vent out their emotions to, but are unable to do it uh, in a safe way because they're expected to be tough and firm in these kinds of situations. Normalization of harmful behaviors, especially negative coping, such as alcohol use, cigarette use, and probably an interesting point to research is substance use, other forms of more illicit substance. Risk-taking behavior and private and public stigma are also forms of risks among men. Then on the other hand, we see that family and peer support, especially those systems which are more understanding of men's concerns, is a form of resilience factor. Self-awareness and acceptance of one's own vulnerabilities tend to protect them as well and motivate them to seek help, which is very important in this uh, times. Okay. Among LGBT members, and this is an outcome of a series of interviews that I've done among individuals who are part of the LGBT community. The main risk factor for them is isolation. followed by non-acceptance, especially by family members. So they feel isolated, especially those LGBTs who are uh, not accepted in the family and who prior to the pandemic spend more time with their communities as their safe space. There's also lack of information on where to seek help, a difficulty in accessing healthcare services due to protocols, mental health stigma, and obstacles in advocating LGBT rights, which they find important because they believe that if they're able to advocate for their rights, they're also able to advocate for greater access to services, including mental health services. And on the other hand, the resilience factors that we mentioned include being able to acquire or accomplish what they value, which means being able to do productive and creative things, forms of entertainment that are available to them, making use of social media, family support, their ability to reconnect with peer groups, especially who are also part of the LGBT community, the use of online platforms for their advocacies, and telemental health, which bridges the gap between uh, the therapists that help them and uh, who are unable to meet them face to face. So with this understanding of the risk and protective factors, as primary caregivers, what can we possibly do to help people across different genders? Of course, there are different models and different frameworks, but I'd like only to focus on the things that we do in the organizations that I'm affiliated with in terms of engendering psychosocial well-being and to be able to share you uh, those things that we do, we go back to the pyramid of care, wherein we have two very important dimensions. First is self care, which means that we need to promote self care for those people, especially now that there is a challenge in keeping approximate distance with them, or it is not as easy as before to set a face-to-face schedule where we can talk about things. So in most cases, young adolescents and young adults are in their homes, and we should, as caregivers, we should be able to empower them to care for themselves as a first line of defense. Then the other side, of course, is other care. Now, if someone who is experiencing some level of distress, what are the potential things that you can do based on our scope of practice? Of course, since many of us are uh, probably medical professionals or helping professionals, then you can do more as practitioners. But uh, what are the other things that we can probably do? Say, for example, if we don't have the training or that scope of practice, so we go to self care, and the messaging that we want to deliver to the people that we work with is that it is not selfish to care for the self. This is especially true among mothers who tend to prioritize their family than themselves, and who finds caring for the self as a selfish thing, especially because it prioritizes the self rather than others. But what we want to make them realize is that caring for the self is just refilling the cup so that they can give more later on. And when we talk about self-care, we go through reflection about three important things. What are these things? First is awareness of what you need and what you have, and what the thing are the things that you are doing that are helping you, and what are the things that work for you. Second is balance, which is ensuring that your coping mechanisms are positive and productive, and that you create a certain balance between your uh, resources and the demands that you have. And finally, is connection. That in times of uncertainty, it is always good to seek social support from the people that are uh, around us and that are uh, willing to help us and whom we trust as well. And of course, when we talk about self care, we ensure a holistic form of self care, wherein we ensure that we are physically well, emotionally, intellectually, sensorially, socially, and spiritually. So different aspects of ourselves and of our well-being have to be taken into consideration. And as healthcare professionals, what we do is we facilitate them to be able to identify what are the regimens that they can do in this particular aspect so that they can uh, take care of themselves and these different dimensions of well-being. Then in terms of other care, the messaging that we uh, like to impart is that it is not a sign of weakness to give and receive care from one another or from other people at that matter. And in here, what we do with our uh, service users, the people that we work with, is that we empower them to be able to help others through basic psychological first aid, for instance, wherein we encourage them to adhere to a certain set of principle uh, in a process through which they can provide humane support to those people who are in distress. So, what are these principles? So prepare, meaning that they're able to understand the crisis situation they are in, that they're able to map out the needs and resources, and that they're able to keep themselves safe and secure amid the crisis situation. Second is look, that they're able to observe safety precautions for themselves and for the other people that they're helping with, that they're able to identify the basic needs of the other person they are helping with and how the person is reacting to the situation. Third is listen, which means that we encourage the people we are helping with to uh, articulate what their needs and concerns are and listen, that we're able to listen to them so that they can be feeling calm and stabilized amidst the confusing situation. And finally is link, that is if we are able to provide the needs that they have, then by all means we can provide through our scope of practice or through tapping on our resources. But that if we are not able to provide the needs that we articulated, then we can link them to people and organizations who can support them in these needs. It also mean uh, service usually that people need in times of crisis is coping mechanisms and information that they can use to navigate the difficult situation. Then, of course, specifically in Balik Kalipay Center, we also make use of psychosocial processing framework, which is a process of allowing people reflect and make sense of these crisis situations that they have experienced by looking at four important things. First is kalooban, which is the inner realities and thoughts and feelings that they have, whether it is uh, uh, affecting them in a certain way. Second is kapwa, which is a reflection on how they are in terms of their relationships with themselves, with others, and with the greater world. Are they able to build a positive relationship within the family, within the community, and are they able to trust the safety of the environment where they are in? Third is kakayahan, wherein we process and talk about resources and capabilities and try to balance out, try to identify uh, organizations and individuals whom they can seek help from to access these resources, especially if they lack it. And fourth and most importantly is kabuluhan, or meaning, wherein we ask people to ponder about what is the sense of this experience to you? What are the opportunities that you can find from this experience? What are the things that you learn from these experiences? And through this psychosocial processing framework, we are able to create a renewed sense of understanding of the crisis situation. And usually, after the psychosocial processing framework, the people we work with tend to have a wider outlook about their situation. They're able to go out of themselves and look at the crisis situation in perspective. And of course, the salient part that we impart is that part of that self-care and other care is help seeking, approaching mental health professionals when needed, and We are also empowering them to identify certain red flags that they can use to assess when is the time to approach mental health professionals. And this is also part of our advocacy to widen their network of support, and also to normalize seeking help from medical doctors, from mental health professionals, especially in a society where stigma on mental health is still prevalent. So we need to encourage people to seek help uh, in situations that they should be seeking help already. And this is a message that we want to impart to them, that it is okay, that it is a sign of strength when you actually seek help and support from other people. So with those things that I have imparted, I hope that you have gained some insights on what we do and what you can possibly do in your own practice. And hopefully with those things that we learned and realized, we will try to create a caring and compassionate community and family and selves as we go about with this pandemic and challenge that we are in. And that we always ponder the fact that all of us are part of one another's healing in this situation that we are in. So here I would like to thank the Philippine Academy for Family Physicians and all of you for taking time to listen to this lecture. You have a great day, and if you have any questions, feel free to email me, and I would be very glad to converse with you on your thoughts. Thank you very much.